This program was made possible by grants from the John and Diane Laxmi Family Charitable Fund, the Asfar and Maheen Malik Family Foundation, and the Missouri Asian American Youth Foundation.
I think a lot of it is about that fear of control, that not having control, like the medication is doing the work for them, versus in therapy that they feel like they're the ones who are motivated and doing that work.
Hi, I'm Aisha Sultan, and these are things we don't talk about. Malik has a clinical mental health diagnosis of bipolar disorder. His father doesn't want him to take a psychiatric medicine. He's fearful about the side effects, both short and long term. And his parents are worried that it could hurt their child's career to have a diagnosis in his medical health record. I'm joined by psychiatrist Dr. Kelechi Loynd and Dr. Neha Navsaria, a clinical psychologist, to better understand Malik's options in this hypothetical situation. So what would you guys say to Malik's parents in a situation like this?
So I think one of the first questions to consider is, what are the information that the father is lacking in order to make the decision for their child? I'm assuming this is a minor that has a parent who's concerned, but even if it's an adult, we always have to start with information, because information is a very powerful tool. And so I would, as a psychiatrist, I would offer an opportunity to just engage them, to ask questions about what do they know about the diagnosis? What does it mean for someone in the family to have, this bipolar diagnosis? Whether they're fearful of, that you mentioned, fearful of getting a job, or how is it going to label them? These are all real things, right? So when you find out where the person's having concerns, then you're better able to manage answering those questions and providing what it is that would help them make a decision that's in their favor, whether it's towards medicine or not.
What do you say to parents or a patient that comes out with an outright fear or refusal to take any medication?
Yeah, that does happen often, actually. It's important to remember that this is part of a normal reaction, right? It's a big diagnosis someone just gave you or a family member. And sometimes it takes time to even digest what that means now for your new normal, right? So some of that is just the process of the change that is now a diagnosis. And I think it's important for the psychiatrist, I really just give them time and space to say, look, I'm here. I want to hear what your concerns are. I want to hear what you're fearful of. And we can walk through it, one step at a time. You don't have to do it all today at this appointment, but just allowing them to be able to have the information to make a better choice for themselves.
What are the biggest concerns you hear from patients who come to you in therapy and say, there's no way I want to take any medication?
I think a lot of it is about that fear of control, that not having control, like the medication is doing the work for them, versus in therapy that they feel like they're the ones who are motivated and doing that work. So we often talk about, it's okay to start therapy and not be on medication, but this is something that we may continue to monitor, and we might want to see if we do want to recommend seeing your psychiatrist for medications.
What makes you know that I should probably take that step?
It depends on sort of how your symptoms are, how it's something that interferes or impairs with the daily functioning in your life, and whether or not you're able to implement a lot of the things that we talk about in therapy.
And when a person comes to you and says, okay, I have a lot of fears about the safety of these medicines, do you feel like you can say that they are safe, or do you have to talk to them about the possible side effects? How does that conversation unfold?
Yeah, that conversation often happens. People are worried about medications and their safety. This is not unusual, and there are definitely lots of opportunity to explain to them and provide information that would help them make a better choice. Information like how the medication gets FDA approved, information about the clinical trials that the medications have gone through. The first phase of putting a medicine on the market is assessing for its safety. So it has to pass the phase 1, which is about safety. Then we go to phase 2, which looks at, is this medicine treatment going to work, right? For whatever diagnosis that we're trying. And then phase 3 is also, is it better than what we already have? And is there going to be side effects related, and so on and so forth? All the way to phase 4, where you continue, even after the medicine gets FDA approved, you continue to study it to make sure that people are on it, continue to stay safe. And these are hundreds and thousands of people being studied. So we can make sure that when we're saying, hey, you need to take this medicine, it's the best option we have for what you have going for you at that time.
And what kind of side effects do you warn people about?
Well, it depends on the medicine, right? So each medicine is going to come with its own risk and benefit profile and side effect, profile. A lot of the psychiatric medications, like, for example, the SSRI, which are the medicines that we use for anxiety and depression, because they work by increasing serotonin levels in the brain, they are also activating those same serotonin receptors in the gut. And so therefore, you may have a little queasy belly, you may have some diarrhea, you may have a little bit of a nausea.
How long do you have to stick with it?
Usually within 10 days, 1 to 2 weeks, the GI side effects tend to subside. And if you have a side effect that doesn't go away, then talk to your doctor. That's where we come back and reassess. Then what are the options?
How often do you have to change medications?
It depends on the person, right? So when you start medications like SSRIs, you're supposed to stay on them for 4 to 6 weeks to get to the therapeutic range. So it's not a medicine that you start and is it working after a day? It's not a happiness pill. It's an antidepressant and an anti-anxiety medicine. So it's important to assess what people's goals are with medicine before they get started on it, right? So it's not a happiness pill. It's going to help you come out of depression or help you with your anxiety so you can function, like Neha said, in your daily activities. And so it depends. Some people I see after I start their medicine in 2 weeks, depending, to see if they're tolerating it okay. And others can wait a month until they can come back.
Now, what are the challenges for different communities when it comes to medication and psychiatric diagnoses?
Well, I think for some communities, it's how often it's not really talked about. So I think it's either a sense of that this is a sign of weakness, or that we might be the only ones who are taking this and nobody else is taking it. And it's medical information. So people might not be talking about it all the time, but it is something that I think people are not aware of what's going on in their communities or even extended families.
Right. Like, it's much more common for someone to say, I have diabetes, I take medicine for my diabetes. But like in Asian American cultures, people don't normally offer up that I take this psychiatric medicine. Is that the same? Have you seen that also in other communities?
Yeah, I think definitely. I think in African-American communities, a lot of minority communities have the same problem where we're not having the conversations that would generate, getting help. But I think mental health is everybody's business. It's the elephant in the room that we don't want to talk about. And we all have it in family, history and in the society. And it's just important that we continue to push for awareness and improve, decrease the stigma.
Right, and also help people figure out how to access it. I think in some communities, you're like, okay, I'm struggling, I don't want to take medicine, or maybe I just only want medicine and I don't want to talk about my problems with an outsider, right? Yeah. And so how do people decide which path, who do I find, how do I find someone to help me?
Well, in some situations, there might be local organizations like centered around your community that can start guiding you. For example, in like many cities, there are associations specific to South Asian communities or Asian American communities that are more kind of centered around social services. And so they connect you with somebody who can help connect you with whether it's a therapist, whether it's a psychiatrist, or whoever it is that you might need. And sometimes I think it's kind of like you're entering like a extended family in some ways. So I think sometimes that being an entry point is a very comfortable entry point for a lot in those communities.
But I think in some communities, people don't want to talk to someone who might know their family or who might know someone else who knows them.
Yeah, so I think that's an important thing to consider, right? Because they want to keep it within their family. We don't talk about
Right.
Bruno or whatever it is,
Right.
But I think it is important that those entry points that she's talking about are there for people to know that they are there. The entry point can be as simple as your pediatrician.
Oh.
Somebody who you already know, who you've been seeing for a long time. It could be a family care doctor. And then they can then kind of hold your hand in the right direction. Then maybe you need a therapist or counselor. But it doesn't have to be, full on. You're going to go see a therapist, a psychotherapist, or a psychiatrist. Your school social worker for kids who are struggling, your teacher that you trust. The biggest thing is just to not struggle alone, make sure that we're talking about what could be ailing us.
What are some of the consequences about wanting to ignore what we're feeling and not seeking help?
Well, we know that there's a lot of burden with mental health, right? It causes a lot of burden in our society, lots of deficits with like work loss. And, if we don't treat depression and anxiety, there are consequences that go all the way to death, right? So suicide is a leading cause of death in young people and in our society in general. And so I do think that there are serious consequences when we choose to ignore mental health.
Right.
Yeah.
Well, and I think it's also just that ability of not being able to function and sort of like maximize any of the settings that you're in. So just taking the opportunities that you normally would have been able to take, or being there for your family in a certain way, or supporting others.
Do you think that some people might also not know that it's possible to feel better because they felt one way for a long time and they think this is the way I'm just going to feel now?
Absolutely.
I think a big thing that we see often is this loss of hope. And that's often a point where people are in that sort of type of despair, where they've been functioning that way for such a long time that, like you're saying, they can't see that it could be anything different. So why would meds help me? Why would medication help me? Why would therapy help me? Why would talking to somebody help me?
Okay, we're also going to talk about another hypothetical situation of a young woman named Tara. She knows that she should talk to a counselor about a problem that she's having with her parents at home, but she's really worried about feeling disloyal to them by talking about her family issues with an outsider, or even possibly saying something that could get them in trouble. Is there something that people could say in therapy or to a psychiatrist that could affect them in the outside world?
Well, we typically think about safety as a paramount. So if you were to tell a psychiatrist or your therapist something that indicates that you're not safe, or people around you are not safe, you're planning on hurting yourself, thinking about hurting somebody else, that is something that we're mandated reporters. So that would be something we couldn't contain in the confidentiality between ourselves and the patient. People would have to know, because you would have to get help. So those situations are, they occur, but they're not the prominent situation. Most of the time, people are able to, quite frankly, pick what they choose to talk about in therapy. The therapist is there as your facilitator, your guide, but they don't, they're not pulling stuff out. You talk about what you feel most comfortable when you're ready for it. And I think it's important for people to note that happens in therapy.
Yeah, and you usually spend a lot of time sharing that, especially with a child or an adolescent, about, these are the situations where I would have to say something, and these are the situations where this is your session, it's about you, and whatever you talk about in this room stays in this room. So we do make that very clear in the beginning, so there's not confusion about that, or that fear is not keeping the child from sharing something in
from
therapy.
Being honest or being fearful about what I say could get my family in trouble. But what about the emotional block about saying something critical of parents that you feel like, I know they love me, or, I know they're trying their best? How do you help people overcome that?
And that is the process of therapy, because for some, it's that difficulty in even going there.
Right.
And so we pace that. Like, again, therapy is about that person and that individual session. So if they're not ready to say that, then that's not, it's not my goal as a therapist. It's their goal, it's their session. So then we want to sort of work on that and talk about what might be preventing them from saying that, and kind of exploring that some more.
And what do you think our communities don't talk about when it comes to either psychiatric medicines, medications, diagnoses, or therapy?
Well, there's a lot that we don't talk about, quite frankly. I mean, I think part of what we may need to improve on is even our expectations of medication, right? I mean, so when you look at those studies that I was talking about, antidepressants may help half of the people, right? And so there are these other half that we need to figure out what else is going to be helpful to them. Is that therapy? Is it a combination of medication and therapy? Is it a different modality of treatments that are also coming and being FDA approved? So I don't think we talk about, people sometimes think it's a magic pill, right? And so that's also inaccurate. So we need to make sure that the expectations are in line with what the medicines can actually do.
Right. And we definitely don't talk about the types of diagnoses that exist and what they actually look like versus what people guess they could be. Oftentimes those diagnoses are kind of thrown around in conversation or with kids joking, and we don't actually talk about what they mean. So that's one piece. And then also, like, what does it actually mean to be in therapy? Because that's not anything you kind of see it on TV and they kind of solve somebody's problems in like a very quick conversation, but really explaining like what it means. Because sometimes it's minimized. It's like, what are you going to get out of talking to somebody? Right. But it's a certain type of talking where someone is able to feel validated. We don't get that enough, with each other. And I think that's why I think we don't realize how empowering it can be to sit one-on-one with somebody and have that person be present, listening to you, but also guiding you. It's not just the therapist saying, well, I think you should do this.
Why should we talk about things that are painful from our past? Isn't it better just to push that away and not think about it? You got over it, you survived it, I don't want to go back there.
Because there's so much that goes with that. There's so much learning that can happen from that, of being able to pause and process it and to figure out, like, how is it that I actually got through this challenge? Like, versus saying, well, I got through it, I'm great, let's just push it away. How is it that I got through that? What were the strengths that I had? What was it that I had to tell myself? And sometimes you don't figure that out unless you talk to somebody about that to kind of really like deconstruct, like, what is it that just happened? Or it could be tied to like, these were patterns in the past and how those patterns in the past might be connecting to what's going on right now. And sometimes life moves quickly. We sometimes don't even have the chance to even make those connections.
So things that have happened in your past might be impacting what's happening to you now, and you might not even realize it?
Absolutely. I mean, the biggest predictor of the future is a past history, right? And along those lines, when you don't talk about things, some people may have panic attacks or they may become hypervigilant, and where, things remind them of their past, and then they find, oh, I'm not doing as well sweeping it under the rug as I thought I was, so here I am now breaking down with a nervous breakdown or a panic attack or nightmares. So there are ways that our body tells us that we haven't quite processed our trauma, and which is why it is important to give note to that and work through it.
How many people in this world actually have trauma, though? Is that just thrown around too casually?
It's actually more common than we think. And trauma also has a broad definition. So I think oftentimes when we think of the word trauma, we think of like some shocking, huge event that's occurred, versus it could be a series of small things that build up, that cause sort of these stresses over time and sort of daily stresses. Or it could be something big, and it could be just things of like how somebody was talking to you most of your life, and you might not realize it until you step out of it.
Yeah, I mean, trauma definitely is real, and we can actually get down to getting to the place where we can actually have imprints on our genes from like the traumatic experiences that we've had. And so it's important to take note of that. Like, I don't think trauma, it does happen more often, as you mentioned. It's something that really does demand our attention in order to notice it so that we can work through the future without repeating the trauma.
Isn't it scary to go there, though? I mean,
It is. And that's why no one's asking anybody to do it alone. It's like so much of specific therapies that are focused on it, like we call it like a trauma narrative. It's about helping somebody develop the skills so they can actually talk about it in a way where they're not sort of triggering themselves, or they feel safe. It all depends on like what you said, like the triggers that come up for them, how to then learn skills that manage all of those things. So it's not just like, oh, talk about it, now you've talked about it, we're ready to go. It's what are the things, whether it's relaxation, whether it's even just the messages you tell yourself in that moment, because we have all these automatic thoughts that we never really pause and think about unless we actually process that with somebody. I always say, like, therapy is like a mirror. You kind of learn, like, all of us can look at ourselves in the mirror and see something. And therapy is in that way, that it's sort of a mirror to what's going on, and it kind of helps you see something in a different perspective.
Do you see people getting better, like within a certain amount of time when they start coming to see you? Can you give hope to people who are watching?
Yeah, you just read my mind as I was listening. I was thinking, but the good news is that these things do work, you know?
Yeah.
And therapy is wonderful, and it can help a lot of people. And so are the medications that we have that do help a lot of people. So it's really beautiful to see someone come in without hope, downtrodden, thinking they don't belong here. I want to do it on my own, but now I'm here, or something big has happened. They're in the hospital because they had a manic episode. And then you start a pill and you start therapy, and things just continue to improve one day at a time. It really is remarkable, and it's the best part of my job when they come back, and I don't know how they've done, but then they come back and it's like almost a whole new person, you know, who can continue to grow, right? Because they're now in the place where their headspace can take more, you know, growth.
And I feel like if people told those stories where I was struggling with this, I talked to someone else, or I took medication, and now I'm feeling so much better, that might encourage other people in your community to do that.
The psychotropic medications are one of the most common prescribed medications. And so people are taking medicines. We're just not telling our neighbors and our, you know, other people who are struggling that this is what's helping us. And so we tend to feel like we're alone. And that's the worst feeling as a human being, right? And we want to be able to connect to, oh, you know what I'm going through. And that helps. If it helps you, maybe I too can get help. So important, you know, to be not alone in any struggle.
Yeah. And I think that people often see sort of the success towards, like, how therapy ends. And people are looking and saying, oh, that person's put together. But for someone like that then to share, no, I actually struggled with whatever it is for years, and I saw a therapist for years, and this is like I think sometimes people are shocked, but then they realize what's on the outside doesn't always match sort of what you think the inside story should be.
Right. No, that's a wonderful point. What's the single biggest barrier that if it was removed, you feel like so many more people could get help?
I think, well, from the therapy side of things, I think awareness of what therapy is and access. Those are two things. But being able to know that they can know where to go to find therapy, because that is, you know, we do have a mental health crisis, especially in the pediatric area, and it's hard to find therapists. And I think, but it's also then knowing what do you do in therapy, because there's still a lot of confusion around that of what am I walking into. Sometimes parents don't know what their role is going to be in therapy, and I think even for a parent to know that sort of helps move them along as well. And
I've talked to parents who've told me that I have to wait 4 months to get an appointment with a therapist, or this therapist that was highly recommended to me isn't taking any more patients because they're so overworked or so overloaded their cases. So then just knowing that, okay, keep trying, because you'll find someone.
Yes. And I think even if there are opportunities where it might not be formal therapy, but even if there's support groups or even youth groups, or like even in whether it's in your church or in a temple or any sort of community group, sometimes just the act of hearing somebody else talk about their experience, even if it's not in a therapy setting, can do wonders.
Oh, that's great.
Yeah, no, I would agree 100% with those things. I think the barrier to care and the cost, right? So, you know, some people can't afford it. They don't have the right insurance. Some people need long-term care or residential, and they don't have that. I mean, children and adults are on the spectrum of autism have very limited resources available to them, even when they need hospitalizations. There's no beds. People stay in the ERs for lots of days waiting for a bed. And so that is a huge barrier. So if a kid's agitated at home and the parent's option is to take that kid to the hospital, but I know I'm going to wait another 48 hours more before I can get him into the hospital, they're going to be more likely not to do that.
Right.
And so, but that's not the ideal situation. So increasing access and resources in mental health is huge.
Yeah, and part of that is increasing more people entering the mental health field as providers. So there aren't the big backups and the waits to get services that you need, and people who have cultural competencies in treating different communities, so everyone feels more understood and more seen in these conversations.
Yeah, that's one of the biggest barriers for a lot of communities of which ones actually seek out services versus not, is whether those therapists are trained from a culturally competent level.
Yeah.
What do you think about the proliferation of apps that can provide therapy or mental health services?
So there are a lot of apps out there, which is a good thing, but that can also be very overwhelming for any individual looking into it or a parent looking into it. It is important to look at the apps that have a strong evidence base. So basically there's a lot of research behind it, because there are, we don't want to say that, well, we don't know if the apps work or not, and then you miss out on some opportunities. So there are a number of apps that do have a good research base to them. I think the positive benefits for the apps are that, if you go into the community, as we talked about, you might have to wait a number of months. So the access is there. And, therapy is a commitment. It's often going in weekly for a good number of weeks before you start to see improvements. And so being able to do that from the comfort of your home, at your own schedule, there are benefits to that. There are also then apps that might not have that strong evidence base, or, might not have that sort of connection with the therapist that they choose to be on it. So it is very important to learn about the therapist or the practitioner that you're seeking. And if you don't, connect to that person, or if you feel like they're not connecting to the things that you're talking about, it's okay. Like, it doesn't mean that you've failed therapy. It means that you just haven't found somebody who's a good match for you. And this happens all the time.
Oh, I love to hear you say that you can't fail at doing therapy. You might just not have someone that was the right match for you.
Yeah,
absolutely.
Thank you, ladies, so much for coming and joining me in this conversation of things that we don't talk about and things that we should be talking about a lot more often.
Thank you.
I tell people, though, that has to be something that you can go through. It doesn't stay prolonged. So it's not like you're going to have the nausea and the side effects continuing on. So it's important to stick with the medicine versus give it up in the first week or two.